Okay, our group is going to talk about the role of weight loss in the management of diabetes in children. So the whole reason that you want to lose weight if you have this disease is because it gives you better management of it. That is, specifically, it helps with control of blood sugar. So diabetes has a lot of complications. For example, it can lead to blindness because of damage to the blood vessels and the retina of the eye. A lot of people that have diabetes eventually end up on dialysis because of what it does to the internal structures in the kidneys. And then another complication is that it often leads to amputations because of circulation problems. For example, you can lose fingers and toes, hands and feet, or even arms and legs. But you can reduce the chance of having these complications substantially if you do a good job of controlling your blood sugar. And weight loss is one very good tool in controlling diabetes. So the expected outcome of weight loss is going to depend on what kind of diabetes you have. For example, if you have type 1 diabetes, it's not going to be realistic to expect you to get off of insulin, because that's more or less what the definition of this disease is, that your body isn't making any of its own insulin anymore. But you might end up that you need less insulin, or you might get better controls of your blood sugar levels. They might not fluctuate. It might be easier to control the disease. If you have type 2 diabetes, you might be able to reduce your medications. And if you have it to the point that you already are insulin dependent, you might be able to take less insulin or even go off insulin entirely. And this is because weight loss is going to reduce insulin resistance, which is basically what type 2 diabetes is all about. And when you lose weight, the tissues and the cells become sensitive to insulin again. And then finally, there's a whole segment of the population that is pre-diabetic. And what this means is that their blood sugar levels aren't bad enough yet to be considered diabetic, but they're higher than what they should be. And in this case, with weight loss, it's not unrealistic that the symptoms might actually disappear, at least for a while yet. It's like you can actually turn the clock back on the development of diabetes with lifestyle changes if you start early enough. Okay, this chart shows the increase in obesity that is occurring in children. So these are statistics from 1980 and from 2006. And what you see is that in 1980, about 5% of kids are obese, or about 1 in 20. And in 2006, it's more like 17%, or getting close to 20%, which is essentially 1 in 5. So obesity over the last 25 years has increased about fourfold. And the reason that this is important is because type 2 diabetes is associated with obesity. And although the mechanism is not completely understood, approximately 80% to 90% of people who have type 2 diabetes are obese. So when you put these two facts together, that is the obesity epidemic in children and the connection between these two diseases, it's the inevitable conclusion is that you're going to have an increase in the incidence of type 2 diabetes in children.
Exercise for children with diabetes is very important, and how it can help them is it can give them better health for life. Exercise strengthens bones and muscles and reduces the risk of heart disease and some types of cancer as well. Greater physical abilities. With exercise, kids can gain better coordination, balance, strength, and endurance. Exercise can increase energy levels too. Better responses to insulin and better blood sugar control. Exercise makes insulin work better in the body, which helps someone with diabetes keep their blood sugar levels in a healthier range. It can help with weight management. To reach and maintain a healthy weight. Eating right isn't enough. People need to exercise. Exercise burns calories and builds muscle, which in turn helps the body burn more calories. And in people with either type 1 or type 2 diabetes, having too much body fat keeps insulin from working as well to control blood sugar levels. It'll improve your life experience. When kids get out of the house and go outdoors or visit a gym, they get a chance to meet new people and have new interesting experiences. If they try a sport, they also can learn about teamwork and sportsmanship and competition and stuff like that. Increased confidence. Exercise helps boost kids' self-esteem and confidence by mastering a skill, improving physical abilities, or helping a team. Kids learn about what they're capable of achieving. Mental boost. Exercise can help relieve tension and stress, encourage relaxation, and improve mood. All exercise is great. Walking, running, playing sports is important for all children to get 60 minutes, at least 60 minutes a day, 5 to 6 days a week. Exercise tips for kids with diabetes. You can adjust blood testing schedules. Your doctor will outline any changes in the frequency or timing of blood sugar tests when your child exercises. Take insulin on schedule. Your doctor might recommend adjusting the insulin dosage for exercise or sports. Eat right. The healthcare team will also help you adjust your child's meal plan to provide the extra energy needed for exercise. They might recommend extra snacks before, during, or after exercise. Encourage your child to stick to the recommendations and explain the consequences of not doing so. Like low blood sugar would be one of the consequences. Besides the symptoms it can produce, hypoglycemia can interfere with your child's sports performance and ability to participate. Kids, especially teens, may be tempted to try strategies like carb loading before running, reducing calories or water to get down to a certain weight for sports like wrestling. These behaviors can cause problems because they can increase the likelihood of either hyperglycemia or hypoglycemia. As I said earlier, it's important for you to bring snacks and water, whether you're playing football at school or swimming in your backyard. You should always have snacks and water on hand. Some quick sugar will help if your blood sugar dips too low. Drinking water will help prevent dehydration. And some of the things that you could have on hand, some quick acting forms of sugar for diabetics. They actually sell tablets. They have Lifesavers, Snickers, or a fruit juice to get their sugar levels back up. Also, you should pack it up. If your child will be exercising away from home, pack all the supplies that you'll need. Tell your coaches if you have it, so that if anything happens to you, they know what to do. And you should take control of your own health. You should be able to manage your diabetes properly without having to interrupt your coach or teacher. You should know what to do.
It is important for children with diabetes to reach and maintain a healthy weight. They feel better about themselves and have more energy. Reaching and maintaining a healthy weight could cause diabetes symptoms to decrease Their blood sugar levels may be easier to control, and they may be less likely to develop complications from diabetes, like heart disease. Extreme dieting can throw blood sugar levels off track and can be very unhealthy, and it is important not to skip meals. A child's weight can be determined healthy or not by using the body mass index. Overweight children tend to have low self-esteem, so emotional support from family and parents is important. It is also important to talk to the child about being healthy, not about feeling fat or thin. Parents and children need to follow a healthy meal plan. If the child has type 1 diabetes, the meal plan needs to ensure proper nutrition for growth. If the child has type 2 diabetes, the meal plan should outline appropriate changes in eating habits that lead to better energy balance and prevent obesity. Children, as well as the parents, need to be aware of portion sizes, the amount of calories for the child's age, and activity level. Children with diabetes also need regular physical activity. Parents need to be aware of the types of snacks that are in the home and how quickly they are being consumed. Nutritious foods help balance carb intake, physical activity, and insulin to maintain good blood sugar. You should encourage your child to eat lots of vegetables every day as well as fresh fruits. Make their grains whole, reduce the amounts of white breads and rice, avoid foods with trans fats and saturated fats, but incorporate the heart-healthy fats like avocados. Proteins need to be lean and build strong muscles, which help build strong muscles and bones. Choose non-fat or low-fat dairy, and reduce the amounts of sweetened fruit drinks, desserts, and sweets, which have a lot of fat and sugar, and make sure they are drinking plenty of water. Snacks can curb hunger while adding a nutritious energy boost to your day. Portion sizes are key to controlling your blood glucose and avoid weight gain. So, some snacks with less than 5 grams of carbs can include 3 celery sticks with a tablespoon of peanut butter, 5 baby carrots, 5 cherry tomatoes, 1 hard-boiled egg, a cup of cucumber slices with a tablespoon of ranch dressing. Some snacks that have about 10 to 20 grams of carbs include a half a cup of almonds or other nuts, a fourth of a cup of dried fruit and nut mix, 1 small apple or orange, 3 cups of light popcorn. Some tips to just remember is to know your portion sizes beforehand and make sure to use measuring cups and spoons, and avoid mindless snacking in front of the TV or while reading and driving.
Okay. Now I'm going to talk about some tips for parents that have kids with diabetes. It's important to plan ahead whenever your child is going to be off schedule, off your normal schedule. So planning ahead involves talking to your child's whole diabetes team, which could include their teacher, the principal of their school, their grandparents, anything like that. It's best to make sure that they have extra insulin and any extra little snacks just in case. Recruit help if you're not going to be at the event. Make sure your child has your phone number, and be sure to recruit an adult who knows how to care for a child with diabetes to help out. Ask the child's teacher, or teach your child to ask the teacher what is in a certain food that they might have at a party, like a cupcake or anything like that. They need to make sure, and they need to know how to take care of themselves. Look it up. Give your child a handy carb counting guide to take with them. Check it out. Your child's blood glucose level should be checked more frequently when off your regular schedule or whenever they're eating unfamiliar foods. And then another tip is called burn it down, which means sometimes exercise helps your body use up glucose. So if your child is having too much blood glucose, they should know that they can run around to burn off a little bit, and that will level them out. So whenever they're going to parties, it's important to fill in the people that are hosting the party, which could be the teacher or a parent of another child. So you need to make sure they know your child has diabetes, they know your emergency phone numbers, and they know how to manage the insulin and then checking the blood glucose levels. You also need to help your child and the host by sharing a healthy treat, so that way your child has something to eat in case they can't eat anything else, because you don't want them to feel left out. So we're heading toward the holidays, so some tips for that. Slim down the recipes that your kids love, and if you don't tell them most times they just won't even know that you changed it. But if you tell them, like I do a lot of times with my mom, they of course like intentionally do not like it. And then you one up the Candyman, fill their treat bags with cool tricks, yo-yos, temporary tattoos, that kind of thing. And so it's always just important with kids with diabetes to plan ahead and make sure that all your bases are covered. And I think that's